Well, if you're making or planning to make changes to your Medicare coverage for next year, that deadline is December 7th.
We've been talking a lot about the rising costs of Medicare premiums and the impact that could have on seniors.
That's devastating. That says to me, I'm 81. If I fall down and break my leg and I have to spend a week or two in the hospital, it's going to cost me a year's wages.
So we want to help you find the best option for you.
KSHB 41 News reporter Elise Schoenig went along as one woman checked off her Medicare to-do list.
Open enrollment for Medicare runs from October 15th to December 7th every year. Experts say it's important to compare all of your plans, to understand your options, and to sign up at the right time so that your health and your wallet don't take a hit.
I have hypothyroidism. I'm diabetic. I had hepatitis B when I was working at the hospital in my 20s. I didn't know I had it, and it wrecked my liver.
Tammy Akers came to her enrollment appointment prepared.
The levothyroxine, that's like $75 a day.
The first step for Akers is seeing what changes she'll need to make from last year's plan.
And so you have to look and see whoever you pick, do they cover the drugs that you're taking? And if they don't, then what?
She's double checking her drug prices and that her providers are in network.
There's so much that you need to know.
That's where Sarah Albin with the Casey Shepherd Center can help.
I think for a lot of older adults, it just really feels like a little bit of a labyrinth. They're a maze.
Good afternoon, Shepherd Center.
Albin says the center's counselors have helped some enrollees save hundreds to thousands just by applying for relief programs they qualify for.
I think it's so hard for especially low-income older adults to manage their costs anymore, and especially just with inflation overall in these last 2 years, they're just really continuing to have to make those decisions between affording groceries and affording their prescriptions.
The AARP recommends comparing original plans with Advantage plans, not missing the window to shop around, and understanding your out-of-pocket costs.
Yeah, the new Medicare card that I got in the mail.
Because if Tammy's to-do list isn't crossed off by the end of enrollment,
it's always nice to see if there's ways to get that covered, but if there's not, then you're stuck.
It's her health that could suffer. Elise Schoenig, KSHB 41 News.